All right. So we have Wendy Gibson here today, joining us for another talk for our Hawaii Epilepsy Awareness Month Education Series. Today, Wendy will be talking to us about Hawaii's medical cannabis program, product safety, and endocannabinoid science. So Wendy Gibson-Viviani is a cannabis nurse educator. She is an RN and a BSN with over 35 years of experience working in healthcare, 20 of those in Hawaii. As a cannabis nurse educator and patient advocate, she is dedicated to promoting excellence in cannabis nursing and the education of healthcare professionals in Hawaii. Her medical cannabis education includes more than 70 medical cannabis continuing education credits, CMEs, and CEUs, as well as attending hundreds of hours of evidence-based learning conferences and webinars taught by some of the most respected cannabis clinicians, researchers, and scientists in the world. She has given presentations to more than 375 healthcare professionals in Hawaii at multiple CEU and CME accredited events, the University of Hawaii at Manoa School of Nursing, healthcare professionals' offices, state healthcare, and governmental agencies in Hawaii, and for the American Cannabis Nurse Association. Wendy will go more into her active membership with the Cannabis Nurse Network, as well as the American Cannabis Nurses Association. So thank you, Wendy, for joining us tonight and for sharing your knowledge and expertise with our community.
Thank you, Naomi, for including medical cannabis in the National Epilepsy Foundation's Epilepsy Awareness Month programs. I think it's very important that we have this included in the conversation. Today, I'm going to talk about medical cannabis, Hawaii's medical cannabis program, product safety, and the endocannabinoid sciences. I'm a cannabis nurse educator. And I've been a medical cannabis patient advocate in Hawaii for 7 of the 29 years that I've been here. I'm not an epilepsy expert, but I do have a passion for learning as much as I can about medical cannabis. I'm a member of the American Cannabis Nurses Association, as well as the Cannabis Nurses Network. I worked as the field organizer for the Drug Policy Forum and Medical Cannabis Coalition for 7 years. And I'm also a member of the Epilepsy Foundation of Hawaii's Professional Advisory Board. I have no conflicts of interest to report, as I don't diagnose or treat patients. I don't endorse any cannabis products, healthcare professionals, or businesses, and I don't profit from cannabis sales. I also do not dispense medical, legal, or dietary advice. What I can do is help healthcare professionals learn about the science behind using cannabinoid medicines. I can help them find continuing education courses, and I can help patients to find a doctor or nurse who certifies qualified patients. And I can help people understand Hawaii's medical cannabis laws because I helped write the guidebook. So it's important that you know the laws in Hawaii before you even think about trying medical cannabis. Hawaii was the first state to permit medicinal use through legislation, and it's regulated by Hawaii's revised statute, chapter 329. That's why the cards are called 329 cards. So in 2015, this was established in 2000, so 21 years ago. In 2015, the program was transferred over from the Department of Public Safety to the Department of Health, and they asked the Drug Policy Forum to help maintain a list of providers to give out to patients, of the doctors and nurses who can certify patients. In 2015, we also passed a bill that allows for medical cannabis dispensaries. In 2017, those first dispensaries and labs opened up. In 2020, when COVID hit, the medical cannabis program and dispensaries were considered to be essential services, and so they stayed in motion. And as of last month, we have over 34,000 patients who have access to whole plant medicines. Now, just a side note, we changed the terminology from marijuana to cannabis in 2017. Cannabis is the correct botanical term for the plant we call Cannabis sativa, whereas marijuana is a racist slang term from the 1930s that we used to use. So back in 2000, when the legislators created or passed the bill that created the medical cannabis program, the vision was that it would promote Hawaii as being an international center for medical research and treatment. And this didn't happen, but what it did do is allow patients to grow their own and have access to whole plant medicines. And the program is administered through the Department of Health's website, the Medical Cannabis Registry Program, and they have two sections to this program. One is the registry program for patients and caregivers, and the other is the dispensary program. So on June 14th next year, we are going to celebrate 22 years of having accepted medical use in Hawaii with Hawaii Medical Cannabis Day. And it was inspired by a request from one of our cannabis clinicians, Dr. Cliff Otto, and proclaimed by Governor Ige that Medical Cannabis Day is June 14th. It's a day to honor our patients. And as of the end of September of this year, our program is more than 34,000 patients strong. Shauna's child, Hannah, who you might have seen in the last section of this program, Shauna's child, Hannah, is one of the 548 patients who are using cannabis to treat epilepsy or seizures. Sadly, though, we only have about 343 doctors and nurses who are qualified to certify. So to access Hawaii's medical cannabis program and become a patient, there are three basic steps to getting your 329 card. The first one is you have to be a patient with a qualifying condition, and then you need to find a qualified provider, schedule an appointment, and then file an online application with the Hawaii Department of Health. You have to have an in-person exam by this qualified provider who will weigh the possible risks and benefits before deciding whether or not to issue a certification. And just know that a provider is not obligated to certify you just because you have a qualifying condition. So then the provider, if they decide to certify you, files online paperwork with the Department of Health. And once the Department of Health approves the application, then the ID cards are available online for the patient and caregivers to print out. Now, it just so happens that Hawaii's list of qualifying conditions does include seizures and epilepsy. And if you need help finding a qualified provider, you can send me an email, or you can check the Department of Health's website. They have a shorter list than I have. You can also watch an instructional video on YouTube on how the application process works. So Hawaii's medical cannabis program has many rules and regulations. It does provide some protections for patients, caregivers, and healthcare professionals. So if you are certified, you and your caregiver are allowed to possess certain quantities of cannabis and drug paraphernalia as long as you follow all the rules. And here are some of these. You must have your state issued ID and 329 card with you at any time that you have cannabis in your possession. You're allowed to use your medicine at home. You cannot travel with cannabis that contains more than 0.3% THC, either by air or sea, because that's federal space. You can travel by car with cannabis. You have to keep it out of sight, locked away, and not on federal roads or property. You cannot grow your own medicine on federal property or federally funded areas, such as military homes and Hawaiian homesteads. So a patient or one caregiver may grow up to 10 tagged plants and possess up to 4 ounces of usable product. You can also have your plants and products lab tested if you have a certified lab on your island, and that's right now just restricted to Oahu and Hawaii Island. Now, right now, patients are growing collectively on properties with more than 5 patients growing together. And there's going to be a limit of 5 cards per property starting in 2023. And there's a Hawaii News Now story about the patient grows being phased out. I encourage you to learn more about the laws, and please do ask me for a copy of the medical use of cannabis. This is a guide to Hawaii's laws for patients and medical professionals. And just please send me an email and I'll send you an electronic version of this. Sadly, these laws don't protect our patients from many discriminations. Patients can lose jobs because of a failed urine drug test. They can be evicted from federally subsidized housing. They can be discriminated against in child custody hearings. They may also be unable to be certified by healthcare providers at the VA or other healthcare organizations. They might be unable to use it in the hospitals or at school. You're not able to travel to other islands with your medicine, and you might not be able to obtain temporary disability insurance or to qualify for life insurance. And you might not be able to benefit from medical research by the University of Hawaii system because they're worried about federal laws and conflicts. So, product safety. We worked hard to get dispensaries in place so that certified patients can have products that are tested and labeled. I worked on a task force and working groups to help create rules and regulations and shape the Hawaii medical dispensary laws. We have highly regulated dispensaries on 4 islands now, and all sales have to be in cash or by this workaround called CanPay app. Inter-island transport is not allowed, and there's no delivery service allowed either. The products that they're allowed to sell are lozenges, flowers, or bud. They can sell extracts, tinctures, or oils, fresh press live resins, vaporization devices and cartridges, and edibles is a new law, but the Department of Health has until 2025 to set the rules. So we're not expecting that edibles are going to be available anytime soon, sooner than 2025 actually. So the dispensaries exercise product safety by having all of their products in child-proof packaging. And most patients in the program use cannabis for severe pain. So just be aware that many of these products are usually higher in THC than CBD, because that's what they're using for pain. Now, the Department of Health allows remediation or reuse of products that initially fail the first lab testing, and they can be sold after passing more testing. And I encourage you to ask if you have concerns about that. And product safety, just as with any other medication, keep all your medications out of reach of children. So, product safety. Buyer beware. Cannabis from hemp is not well regulated, and it might be synthetic. There are many different extraction techniques that are being used. Because it's a fat-based product, you either have to use another oil or a solvent or gas to extract it, but it can also be done using a dry ice method or pressing. Many routes of administration. I've just highlighted the ones in purple that people with epilepsy are more likely to use. That's the sublingual, the drops under the tongue, or rubbed on the gums, swallowed pills, oils, tinctures. There are also nasal sprays available. Some families use these as rescue medications. These have THC and CBD in them. Some patients say that they use inhaled cannabis to control seizures, but I'm not sure that that's the best method to use because dosing is probably more difficult. You can also put the products in G tubes or J tubes, but know that it's really sticky and you might need to flush it out. And you might be buying them. They might be sold in syringes, but just know that it's not for injection. So product safety regarding hemp extract product regulation in Hawaii. There are hemp extracted products that may be sold, and these are limited to tablets and capsules, liquids and tinctures, powders and topicals. What's not allowed, you can't put it in food like CBD gummies or drinks or smokable hemp. They do require lab testing for microbial contaminants, heavy metals, pesticides, and solvents. And just a note on product safety for patients who are growing their own. So on Oahu and Hawaii Island, lab testing for homegrown products is available at Steep Hill Labs. And patients do share medicines, especially because many need more than one type of strain or what we call chemovars to get the results that they need. And again, safety starts at home, so keep these medicines out of reach of children. Product safety is best if you learn how to read lab test results and labels, and you may have to ask for the lab test results. But this will help you find out what's in it or not, and the extraction techniques that were used. It's suggested that you avoid any solvents except for ethyl alcohol and avoid sweeteners or dyes like especially sweetener sorbitol or plastic packaging. Now there's a cute little method that one cannabis nurse uses, and she created flow. And this is for when you're shopping, look for flowers, female flowers, or high resin plants that are lab tested, that are organic, that are whole plant extracts from high resin plants. And the Mayo Clinic has similar suggestions. So what I have up here are lab test results of this product down here from Haley's Hope. And this product is a 20-to-1 ratio product. And that's 20 parts of CBD to 1 part of THC. So the CBD is 21 milligrams roughly, and the THC is 1 milligram roughly. And so that can help you figure out your dosing on that. And this company also offers a dosing calculator. For more information about all of this, I suggest that you check out some of these resources. The Mayo Clinic has a clinician's guide to cannabidiol and hemp oils. There's a guidance on the use of cannabis-based products for medicinal use from the British Pediatric Neurology Association. And then 2 doctors teamed up to create practical considerations in medical cannabis administration and dosing. And then I also suggest that you check out Project CBD, who can help with choosing a product. They have some suggestions on dosing. They don't give specific doses, but they can show you more about how patients dose and about epilepsy in particular. You can also learn from cannabis clinicians. This is one of the cannabis clinicians that I have learned from. He owns a clinic in Maine with a testing lab that tests the medical cannabis products that his patients are using. And they have treated over 18,000 patients in these clinics. He's created a guide for parents considering using cannabis for a child with seizures. He also offers step-by-step dosing, a guide to shopping, endocannabinoid system health, how to keep your own body's cannabis factory healthy. And I'll talk more about what that is soon. He also offers educational programs. There's a free monthly presentation of science, and now he also offers a line of products. Dr. Sulak wants you to know that any medication that can prevent seizures in the wrong patient or at the wrong dose can also cause or increase seizures, and has clearly observed this in patients using CBD and THC. He also warns about that drug-drug interactions are possible and that medical supervision is essential. He also warns that a loss of access to your medicines can be dangerous. He says, many patients who respond well to cannabis are able to wean off some or all of their medications, anti-seizure medications. But if they lose access to a quality assured, consistent product, they may face dangerous consequences such as rebound seizures. And again, I'm not endorsing his products, but I do use his handbook as a guide. So let's dive in to the science behind medical cannabis and figure out as best as we can why we think medical cannabis works well for, many patients. So back in 2018, the National Council of State Boards of Nursing came up with some guidelines for dealing, nursing care of the patient using medical cannabis. And what they suggest strongly is that the nurse shall approach the patient without judgment regarding the patient's choice of treatment or preferences. The nurse shall also have a working knowledge of the current state of legalization of both medical and recreational cannabis, a general understanding of the endocannabinoid system, the cannabinoid receptors, cannabinoids and the interactions between them. So your body's cannabis factory, essentially. The nurse shall also have an understanding of cannabis pharmacology and safety, as well as the research associated with the medical use of cannabis. And I steer other nurses and doctors to these continuing education courses that are being offered by the American Cannabis Nurses Association, the Cannabis Nurses Network, Society of Cannabis Clinicians, and CanMed conferences. So I'm trying to support and teach what I hope will be taught in nursing schools in the near future. So here's the science. Got runner's high? Well, it's probably not from your endogenous opiates or endorphins, but from your body's cannabis factories. It's called the endocannabinoid system. It's thought to be an ancient system that evolved in primitive animals about over 600 million years ago. And the discovery of this system has led to a greater understanding of how our brain chemistry and cannabis works. This ancient system is made up of chemical messengers or neurotransmitters and unique receptors for those. And just as your body produces endogenous opiates, your body produces endogenous cannabinoids. And so that's why they're called endocannabinoids, and that's abbreviated as ECBs. There are two main endocannabinoids, which are neurotransmitters, and these are synthesized from omega-6 fatty acids. The first one is called anandamide, or AEA for short. That is Sanskrit for supreme joy and euphoria and pain relief. That's what we think it helps with. It's also present in human breast milk. The levels of anandamide are higher at night, so we think that's related to the sleep cycle. And THC mimics anandamide, and it just so happens that THC is also famous for inducing deep sleep. So the other endocannabinoid, the main one, there are at least 8, is called 2-AG, because I can't say 2-arachidionyl glycerol too many times before I lose my breath. This 2-AG is most abundant in the brain, and the levels are higher during the day. So we think this is related to alertness. And CBD mimics 2-AG. There's a growing body of evidence for the theory of an endocannabinoid deficiency, that endocannabinoids might be lacking or overproduced in some chronic illnesses and disease states. There is some evidence of a lack in autism and epilepsy, as well as fibromyalgia, migraines, and irritable bowel syndrome, and others. So the question becomes, can this neurotransmitter deficiency be corrected using cannabis? Well, those are neurotransmitters, so they need receptors. So there's 2 main types of cannabinoid receptors. And they're found in nearly all cell walls, neurons, and tissues in your whole body. The CB1 receptors are found primarily in your nervous system and digestive system, whereas CB2s are found primarily in your immune system. And there's a possible third type, the GPR55. And this is one thought to be one of the targets in the anti-convulsive properties of CBD. And it's also activated by THC and anandamide. So the CB1 receptors, the location of them is probably the reason that no one has died from cannabis consumption. Because of the low density of CB1 receptors in the areas of the brain, it can't shut down an adult's breathing or cardiovascular systems. Now, the World Health Organization expert committee looked at lethal doses and they said, well, the lethal dose is really exceedingly high and not likely possible from smoking. The lethal dose for smoking is 1,500 pounds smoked in 15 minutes. And they calculated that the lethal dose in a 70 kilogram human could not be realistically achieved by oral consumption, smoking, or vaporizing a substance, as delta-9 THC has a very large margin of safety. However, that being said, there have been children who were hospitalized after ingesting edibles and they had breathing difficulties. So again, keep medicines out of the reach of children. The endocannabinoid system has a unique neuron-to-neuron signaling system, and it's a unique retrograde system. So most people are familiar with a neuron-to-neuron transfer. The first neuron, the presynaptic neuron, fires, and it goes through a space, the synaptic cleft, and goes to the postsynaptic neuron. Well, with cannabis, the presynaptic neuron fires, and when the signal goes into the synaptic cleft, the postsynaptic neuron turns around and creates endocannabinoids where they're needed, when they're needed, upon demand. So the postsynaptic neuron is creating the chemicals that buffer the effect and hopefully creating homeostasis in every system of your body. It is the master controlling system of your body and thought to mediate the seizure threshold. No prescription drug can mimic this on-demand production. So what is in cannabis that might help control seizures? Well, the plant that we're talking about is Cannabis sativa L, and it's generally accepted that there are three main types or subspecies of Cannabis sativa. There's another Cannabis sativa, Cannabis indica, and Cannabis ruderalis. Most of these are hybrids. So the common term of strain may not really be useful information if you're trying to choose a product. What medical and the scientific term is chemovars or chemical varieties. So we look at what chemicals are in the plant. So the unfertilized female plants produce the best flowers and medicines. A single male plant can fertilize and ruin an entire crop and turn it to seeds. So these medicines are produced in these frosty resin glands called trichomes. And it's mostly on the flowers and in some of the leaves. But these produce hundreds of sticky lipid-based phytochemicals, which you probably already know some of. So the three main types of phytochemicals are cannabinoids, terpenes, and flavonoids. Now the cannabinoids, there's over 146 of those, and you're probably familiar with at least THC and CBD. THC in its raw form is not psychoactive. So if you were to pick a bud or a leaf off of a plant and eat it, you probably would not experience any psychoactivity. It's only when it's heated or aged that it converts into the psychoactive delta-9 THC. If you were to eat it and this THC, the delta-9, goes into your liver makes it stronger, like 5 to 10 times stronger. a different version to 11-hydroxy THC. So that's why edibles might be harder to dose. CBD is so ubiquitous. I would be shocked if nobody has ever heard of CBD before. But did you know that CBD can help buffer the psychoactivity of THC? And that's the anxiety, the paranoia, and possibly short-term memory loss. It can help keep anandamide, or your bliss molecule, in your system longer. We do have some evidence that both THC and CBD can have anti-convulsive or pro-convulsive properties, and that both CBD and THC are thought to be effective in their role for treating pediatric epilepsy. There's a list of other cannabinoids that are being studied for possible anti-epileptic effects. And that's it for the cannabinoids. So terpenes, there's over 200 of these chemicals in cannabis, and flavonoids, there are about 20 of those, and I'm not going to talk much about those. I'm mostly going to focus on terpenes. These are these plants' essential oils that's found in all fruits, flowers, herbs, and trees. It's what gives cannabis its distinct colors, flavors, and aromas. So you might have noticed that there's a real variety of flavors and aromas in cannabis that can be piney, skunky, lemony, spicy, or flowery, and that's because of the terpenes. Some of these have therapeutic uses, and some of them might be responsible for some of the side effects, such as anxiety or relaxation or sedation. In a 2019 review of animal studies, it found anti-seizure properties in at least 6 of the terpenes that are found in cannabis. And of note, there's myrcene, which is found in mangoes and hops, and linalool, which is found in lavender. And of course, more research is always needed, but it appears now that the mechanisms of action that these are using to control seizures might be similar to those of anti-epilepsy drugs. So I'd like to introduce you to the entourage theory. And this is a theory that kind of asks, or sort of says, really says, that the phytochemicals work better together, that whole plant medicines might be more effective because they act on multiple targets and pathways in the body. You might be able to use lower doses of not just cannabinoids, but other medications, and that there may be less side effects than when you're using a single substance. So Epidiolex has both cannabis and trace amounts of THC and other cannabinoids in it. It's the closest thing that we have to a whole plant medicine by prescription. Whole plant cannabis causes fewer psychological side effects than synthetic THC. CBD buffers the psychoactivity of THC and helps keep the anandamide in your system longer. CBD is related to anandamide and shares some of the same molecular targets. So as far as lower doses, there is evidence of CBD-rich extracts being able to use lower doses of that with less side effects. It provides a good safety profile in add-on for young patients with drug-resistant epilepsy, and that's from a very small study done in Italy. And in that, the dosing range for CBD was between 0.7 and 4.4 milligrams per kilogram a day, which is way less than the prescription CBD. So this was also found in that lower doses of THC and CBD were needed to have an effect from chemotherapy drugs, and that botanical extracts were more potent than pure THC in producing anti-tumor responses. Now, there's no high quality studies or randomized controlled trials that support this theory, but it might help us to design our studies. The terpenes have been found to help improve THC absorption in the lungs and increased the blood-brain barrier permeability to THC. Dr. Bonnie Goldstein reports that she's seen these synergies for pain relief, combining THC and CBD with the beta-myrcene and another terpene, and that for insomnia, to combine THC with linalool and myrcene might be more effective. So there are many physicians who embrace this entourage theory that says that cannabinoids have additive, synergistic, or antagonist effects with others, and that the whole is larger than the sum of the parts. In 2014, neurologist Dr. Edward Ma, who's the chief of the Comprehensive Epilepsy Program in Denver Health and Hospitals, says that the desire to isolate and treat with pharmaceutical grade compounds from cannabis, specifically CBD, may be inferior to therapy with whole plant extracts. And a cannabis researcher, Hannes, says the healing power of cannabis most likely resides in the terpenes, terpenoids, and phytocannabinoids. Like any drug, cannabis can have side effects and drug-drug interactions. Both THC and CBD have drug-drug interaction potential. So mostly if it's ingested, but possibly if smoked, medium to high doses of THC or CBD can compete in the liver with other medications, and it can lead to higher or lower levels of your prescription medications. And so we need to use extra caution and medical supervision with drugs that need tight dosing, such as blood thinners, chemotherapy agents, statins, and anti-seizure medications such as clobazam, valproate, and benzodiazepines. And it might be just that you need more frequent lab testing, or to space the doses away from each other, or to lower the doses, or possibly stop using it if you can't avoid drug-drug interactions. So just a rule of thumb, if you're trying to figure out what drugs may have drug-drug interaction potential with cannabis, check out, be very cautious if you're using any drug that has a warning about ingesting grapefruit. And here's a little scary warning. When I was looking at those studies that showed the anti-seizure properties of some essential oils, I also found out that there are some essential oils that may be causing seizures and should be avoided by those with epilepsy. And this can be whether they're inhaled, taken orally, or applied topically. And this of special note was camphor and eucalyptus. So patient support networks are important and really great. I encourage anybody who's using cannabis to try to reach out and build a support network. But there's no shortage of anecdotal success stories to warm our spirits. But remember that we don't hear from patients who it didn't work for. And if you learn from other patients' experiences, be aware that what works for them may not work for you. There's a nice magazine, the August issue of Cannabis Patient Care is all about treatment regimens for seizure disorders, and it includes medical cannabis in there. You can also reach out and talk to the mom, Shauna Metch, who presented Saving Hana. You can also reach out to Flowering Hope Foundation, the Realm of Caring. They collect patient data for research. And also, don't forget support from the Epilepsy Foundation. If you're considering using cannabis for epilepsy, they suggest that you treat it as any other option for treating seizures. To get to know the laws in your area and check out the Epilepsy Foundation's information about advocacy. Make sure you talk to your healthcare team about treating your epilepsy before you decide to just try it. The team may not be able to prescribe cannabis or just doses, but might be able to help monitor it, especially if drug-drug interactions happen. Do ask lots of questions, compare all the pros and cons you can find, and talk to the manufacturer or dispensary about the products that you're getting for instructions. But keep in mind that the instructions probably haven't been scientifically tested. And really important is to keep a written diary of what's happening with you. This is going to be hugely useful for your healthcare team and probably for yourself also. It'll help you keep, the Epilepsy Foundation has My Seizure Diary to help you keep track of all your medications, the schedules, and all of the effects, including side effects. So I highly suggest that you do that too, if you can, and it's an app that you can use on your phone. So Epilepsy Foundation offers support in the form of patient education. Check out their website for questions to consider for medical cannabis and cannabidiol frequently asked questions. And they have monthly support groups for adults living with epilepsy. And then also, I'm really grateful that they're including cannabis discussions in National Epilepsy Awareness Month. So mahalo again to the Epilepsy Foundation for including me in that. The Epilepsy Foundation also supports legal access and research. They said that they support safe and legal access to medical cannabis and CBD if a patient and the healthcare team feels that the potential risks of using it for uncontrolled epilepsy outweigh the risks. Now, not everybody with epilepsy should use cannabis, but some people living with uncontrolled seizures have reported beneficial effects and reduced seizure activity when using medical cannabis, especially strains that are rich in CBD. The Epilepsy Foundation supports opening up research by encouraging federal officials to change the drug scheduling of marijuana. And there are many, many other medical societies and groups that are in support of more research. The American Academy of Pediatrics said, we need to make it easier to study its therapeutic benefits. Some children with debilitating chronic diseases cannot wait for lengthy research and clinical trials before having access to medical marijuana. Advocacy groups, patient advocacy groups have formed over the years. One of those is Patients Out of Time, and they've collected a list of organizations supporting access to therapeutic cannabis. And that includes the American Cannabis Nurses Association, Cannabis Nurses Network, Doctors for Cannabis Regulation, and the Society of Cannabis Clinicians. Now, as far as removing research barriers, the US Congress established the Congressional Cannabis Caucus, I think it was back in 2014. And their mission is to try to harmonize federal laws that conflict with state laws that permit medical and recreational cannabis. There are some bills in motion, the Medical Cannabis Research Act and the MORE Act. In Hawaii, we have had many, many legislative efforts. Back in 2016, we passed a bill that authorizes the University of Hawaii to establish medical marijuana testing and research programs. In, this year, we had a bill that would help establish a cannabinoid medicine program within the University of Hawaii to be administered by the John Burns School of Medicine, and that passed through the Senate but died in the House. And also this year, a resolution was passed, HCR 132, and Dr. Cliff Otto, the physician who inspired Medical Cannabis Day, spearheaded this too. The resolution asks Hawaii's Department of Health to send a request to do the DEA for an exemption to the Controlled Substances Act Schedule 1 drug category, because the state of Hawaii has accepted the medical use of cannabis since 2000. And Dr. Otto explains that this is to remove the misconception that our program is violating federal law. He wants to help eliminate the injuries that our patients and dispensaries are experiencing every day as presumed federal criminals. So I covered a lot. Thank you for hanging in to hear it all. And I just want you to know that this is, well, thank you for having me as part of your program.
Sorry, I didn't mean to cut you off.
No worries.
Did you finish?
Yep.
Okay, well, thank you, Wendy. I have a few questions, if you're okay with that.
Yeah.
So one of the questions is, you mentioned that there are qualified clinicians here in Hawaii to certify people. Where would we find that list?
They have to either email me or the Department of Health just started their own list. I think it was last year, but I've been the one who's been maintaining the list for the last 7 years.
What is the process of being a qualified clinician? How do you become?
It has to be a MD, a DO, or an APRN that has a current Hawaii license to practice, and also has to have a DEA license to prescribe medications or controlled substances. That's pretty much it.
Okay. And then as of today, about how many qualified clinicians?
I think we only have 343.
In Hawaii, we have 343 qualified clinicians to.
Yep.
Oh, that's pretty good.
Yeah, over 34,000 patients. It's just, yeah, we need more.
That's more than I thought. So, and then you said
Okay.
that there were 548 patients, qualified patients. So
Yes.
Okay.
Yes.
You mentioned that in order to travel by car, or if you have the medicine with you, it has to be less than 0.3% THC, correct?
Yes.
And then how is that labeled? How does someone who wants to reinforce some law know what less than 0.3% is?
That can be tricky. If you buy it from a dispensary, it's going to be clearly labeled as having more than 0.3% THC. I don't know. I think law enforcement has got some real challenges here in trying to enforce any of that.
Okay.
Yeah.
So those that want to stay in the know and keep up to date with like your policy work and advocacy with legislative work, how do we keep in contact with you, or keep up?
Well, right now the Drug Policy Forum is in transition. They're in flux, and they may be forming like a merger with another group. And so it's right now, all of our websites are way out of date, like 3 years. I maintain the other social media, like Facebook pages and email accounts. But for right now, until there's some more structure, they're restructuring. So there's nobody. I'm the only one, and they ran out of money to pay me. So my contract expired a couple months ago, So I'm not really considered to be a contractor with them right now. But they're trying to create a space for me, you know, for whatever their future is, but they don't know what it is yet. They're still in, you know, primary stages of meeting with board of directors and creating plans with them. And so the only thing I have to offer up is my Proton email account, because I'm not sure if they're going to close down all of those other email accounts and possibly Facebook pages too. I don't know yet. So I don't want to steer people to something that's not going to continue to exist. So that's why I was just offering up my email for now.
Do you have a slide with your email on it?
I
thought I saw one.
There it is.
There it is. Okay. So anyone watching this at any time.
Yeah. So if they want a copy of the drug laws, a list of the certifying, you know, providers, or just, yeah. If they have any questions, yeah.
Okay.
I'll yeah.
All right.
I'll try to help them, you know, but yeah.
Yeah, for sure. Well, thank you for that very rich and informative presentation.
I'm sorry. I'm sorry it's such a huge information dump, but I think it's really important that people understand, you know, that there is some science behind all of this. It's not just, we're not just flying by the seat of our pants. You know, there's these cannabis clinicians have got it down really well. They're seeing amazing success by the hundreds of patients. It's not, you know, it's, you know, and the stories that we hear are just incredible. It's just, I got to hang out with a refugee family that came from another state that doesn't have medical cannabis. And this child is triple whammy. She's got cerebral palsy, autism, and seizures. And the mother made a cannabis infused coconut oil and puts it on like a pacifier. And she just, you know, when the kid is starting to have behavior issues, tremors, seizures, whatever, she just dips that pacifier in the oil, sticks it in the kid's mouth, and, you know, or rubs it on her gums or whatever. But I watched like 3 times when she keeps her on like a steady dose throughout the day, just low dose. But, you know, for breakthrough, it's just like, it's hard to, you know, and the cannabis clinicians are, you know, they talk about it, they're like, well, one of my girlfriends is an oncology nurse who is well versed in medical cannabis use. And she helped Dr. Goldstein dose, I think it was a 3-year-old with some sort of glioma, brain cancer, or oh no, it was leukemia. And they got such amazing results. It was just incredible, you know, just, but what's even more incredible is seeing like what happens when the supply of medication gets cut off. And then, like, you know, these kids and these people just get worse again. And it's hard to watch because.
Yeah, for sure. But, you know, it's encouraging that research is being done and people like you are advocating for more research or to change laws in order to do research so that this can be a legal and accessible treatment for not just epilepsy and seizures, but for whatever conditions people may have, and to be used as a medicine as needed.
Yeah, thank you so much for your support. I just, you know, and I didn't realize how much support the Epilepsy Foundation really had to offer, and that diary is wonderful. Mm-hmm. I hope a lot of patients use that, because that, you know, that makes all the difference in the world of really knowing what's working and what's not, and what's, you know, just, and I think it even has a feature that it like reminds you, you know, if you missed a dose or something. And it's
there's a bunch of diaries. I have to really go ahead and look into that one. So
yeah,
but
tell me again where you're going on your